My name is Dr. Kahn, and I'm with Affordable Dentures in North Lauderdale. I practice in the South Florida area. I am really new to implants. I started this about a year ago. Started the dental course, and since then I've continued educating myself. And this being I think the third or fourth course that I've taken, live patient course that I've taken. I've placed, gosh, I don't even know. Last year probably 300 or 400 implants, maybe more. But it's still, everything is still a huge learning experience. Everything's still new. I'm constantly reminded about how much I don't know. I have been to a couple of the live patient courses. This course was unique in that it was a very small group. The past courses that I've been to have been larger groups and lots of instructors, a lot of things going on. But this was a very focused group. I was in a group of 6 people, and we had plenty of instructors around. We had all the biomaterials that we could use, instruments. I mean, everything was top notch out here. And to top it all off, the patients were fantastic. So it was amazing. Again, being newer to implants, for me, first it started with like simple singles and then full arch, and you slowly graduate to like the bigger and bigger cases, and then you start seeing your own failures. So it's really important as a clinician to be able to know what to do, know what to refer. That's a lot of what this course taught was in the first day of didactic was learning about the biology, what goes on behind the scenes, what do complications look like. So I would recommend this for anybody. At any level, you need to know like what you're doing as far as what you're doing for your patient. So if you're placing implants in the maxillary, you should know what goes on in the sinus, because that's very proximal to where you're working.